afternoon, dear guests. Welcome to the second edition of the Ignition Hour monthly TV series. The topic of today is on sexual and reproductive health, male and female rights for information and inclusion. As parts of the TV series, we are seeking to develop the entrepreneurial skills of young people through the exchange and the sharing of ideas that will unleash their passion and their self-awareness that is really needed for young entrepreneurs and for the future generation. For this afternoon, we are really delighted to have invited great entrepreneurs in the names of Dr. Bintu Mansaray and Sheiku Foryo. Thank you. Yes, who are two great entrepreneurs who have sexual and reproductive health of young people close to their hearts. Let me first introduce Dr. Bintu Mansaray. Dr. Bintu is the head of pediatrics at the King Harman Road Hospital, and she is the founder and director of Healthy Kids Initiative. She was born in Cambia, and she studied at the Annie Walsh Memorial School, and she furthered her studies and studied medicine at the Department of Medicine and Allied Sciences in Freetown. Dr. Bintu has the health of children very dear to her. It's her passion, and then she further went to Liverpool to study tropical medicine, tropical pediatrics, and she came back home and she initiated the Healthy Kids Initiative that she will walk us through in a moment. So she is also the medical doctor for the Rainbow Initiative, and she helps tweet and write reports for survivors of sexual abuse. So Dr. Bintu, it's our pleasure to have you this afternoon with us, and we would like you to walk us through the great work you're doing on sexual and reproductive health for young people. Thank you.
As we treat family, we understand that I notice that we overlook children, we overlook young women when we're talking about their reproductive health, about their health in general. So I decided to actually educate children themselves. You will be surprised at how much an 8-year-old knows. And we think they don't know much, but actually educating them about their health, about their bodies, about just little things, like secondary school children, for example, they are secondary caregivers of their young ones. So we basically go to schools, we talk to them about child sexual abuse, how to recognize abuse, and the fact that I also work with Rainbow gives me the opportunity to look at these files and to know what to say, at least how they can prevent. So that is what we do. We go to schools, we educate children, we go to the TV, and we try to let them know how they can also prevent common infections like diarrhea, like STIs that we are going to talk about briefly. So that is what we do. So as I said, I've basically introduced the initiative and what we do, and the understanding that every child deserves a champion. Every child deserves somebody who believes in them, that they can actually be something in society. And so, based on the statistics, we already know them. Sierra Leone has really, really bad statistics when it comes to child health. About 120 out of 1,000 kids die before they are 5, and it's mostly from infectious diseases that can be prevented. And also, we've all been hearing about child sexual abuse for the past few months. It's everybody's agenda. So I'm sure everyone here has heard about it. Rainbow has nearly 2,000 cases by the end of 2018. And for a country with 3 million kids, that's a lot of children being abused every year. So as I said, this is what we do. We do education in schools, we do medical outreach, we come to the radio, we come to TVs. We use simple graphics, simple things to actually teach children about their body parts, safety, how to prevent abuse, and when and how to report. Basically, for the next year, we'll continue doing the same thing. We'll continue with medical outreach, we'll continue with the child health series, and we're looking at adopting a clinic because I noticed that the blind and deaf school have been ignored, and statistics actually show that children with disabilities are at an increased risk of child sexual abuse, but no one has been including them in these talks, and so we'll try to include them. So this is about entrepreneurship and activism, and you ask who is supposed to be an activist, who is supposed to be an entrepreneur. Anyone can be, everyone should be. Everyone should be an activist for their own health. So you can be, you can continue in your own field, you can be, or I have a colleague who is a doctor, who is a photographer. I have a cousin who is a pediatric nurse, who is also a farmer. So you can be an entrepreneur even if it's not in your own field. But just try to be an activist for your own health, for somebody else's health, to try to make changes, no matter how small, in your communities. I'm here today to talk about a few sexual and reproductive problems that we sort out and how to seek help if you do have them. The first one we are starting with is STIs. Sexually transmitted infections. We know that they are very common. Young girls have them, they're very vulnerable, and we all know about HIV, the fact that we have high HIV rates in the country. Currently, we believe 67,000 people are living with HIV. Those are the ones that have been confirmed, but only 26% of them are on treatment. That means those not on treatment are a risk for all of their sexual partners. And HIV test and treatment is free in all health facilities. You can go to even your community health center, they're supposed to be able to do a HIV test. And we talk about gonorrhea. Gonorrhea is very common. It's a very common STI. We see among young people especially. And it's very important because of its relationship with something called pelvic inflammatory disease that leads to infertility. And we'll talk briefly about infertility and its role in our culture. And antibiotic resistance. We notice that in Sierra Leone, everyone can walk into a pharmacy and get a drug, even though you don't know what kind of STI you have. So they've noticed like resistance to the current antibiotics. We have chlamydia. I put the age group between 15 to 24. These are young women these are young people who are just starting to have sex. So obviously there are risky sexual behaviors, and it also causes PID, also leads to infertility, and the treatments are common, the treatments are available, so you have to go to the hospital. I put bacterial vaginosis for the fact that we see it because young women in Sierra Leone love to douche. It's like they buy this over-the-counter product and just douche. They douche after sex, they douche after their periods, they just douche. I don't even know what they're douching, but this causes an increase in bacterial vaginosis. And trichomoniasis, it's common, even though the name seems a little bit strange, and it's gotten predominantly through sexual intercourse. So it can be prevented, obviously, by condom use. We can't say only by abstinence, because not everyone can abstain. But we are encouraging condom use as opposed to just contraceptives, because young people are going for contraceptives. Contraceptives is being, how can I put it? We are focused on preventing teenage pregnancies, and it's a good thing. We don't want you getting pregnant, but we don't want you getting diseases as well that will affect you after you finished your education. So I push for condom use. You have to own your own health. You have to be able to negotiate safe sex. You have to be able to say, no love, no glove, no love. because it's my health. I am going to school, I won't get pregnant, I will finish my university, and then you end with HIV or hepatitis. Then what is the point? So I focus on condom use among young people, even before you start having sex, because it's a habit. The guy will say, oh, I don't use condom with you because I trust you. He doesn't have the habit. So I focus on young women who have not even started having sex, for them to understand that you have to have the habit of using a condom, and then you grow with it. And just don't hope that you'll start using it sometime in the future. And we all know about syphilis. The tests are mostly done in private universities like Ramsey and Ecomed. And for countries like ours, for low-income countries, we don't usually test for all of these infections when you come to our facilities. Yes, we test for HIV. But all of these infections, because the treatments are available, because they're easily treated, because they can be put under something called syndromes. For example, you come with abdominal pain, you come with with vaginal discharge, you come with a sore. So we do something called syndromic management. Just by your history, we know exactly what kind of infection you have, or what group of infections you might have had. So we treat based on that. For example, bacterial vaginosis and trichomoniasis, they have nearly the same symptoms, and they can be treated by Flagyl. Of all the ones I've written, it's only them that we treat with Flagyl. But everyone with an infection goes to the pharmacy and comes out with Flagyl. Not all of them can be treated with Flagyl. So basically, this is what are the 5 C's of treatment. Confidentiality. You don't want to be talking to your doctor, everyone is passing by. So you have to ensure that it is a private room. Compliance. We want you to finish your antibiotics, because sometimes you're going to take them for 2 weeks. It's a long time, but you have to complete it. As I said, antibiotic resistance. Contact tracing, we don't do that here. Other countries do, wherein we ask, who are your sexual partners? And then we try to trace them and try to treat them. But as you know, we just don't have the manpower. But we encourage people who come in with an STI to treat their partners, to go and give them the same treatment. And as I said, for me, the most important one is condom use. It's about preventing these infections. We don't even want to treat them. We don't want you to have them. And obviously counseling, because you're going through a lot. And this is the end of the STI slides, and I want to talk about it. I can't not talk about child sexual abuse. A child has no business having an STI. A child should not be having a foul-smelling discharge. So if a child is having a smelly discharge, you have to have the conversation. You have to ask them the questions. We don't want to ask. None of us want to imagine that our loved ones are sexually abused. But children should not be having STIs. Children should not be itching. Children should not be having discharge. So when they do, that is when we see them in the facilities. When a young 8-year-old comes in with gonorrhea, we don't want to see that. So we have to keep that in mind when young kids have discharge. Then female genital mutilation, we have to talk about it. It's something that is a bit ignored. People don't like talking about FGM, but it is very, very much in Sierra Leone. So the map, I just put in the map. This is known as the FGM belt, where FGM is predominant. And you can see Sierra Leone is a dark brown. We are one of the countries with one of the highest rates of female genital mutilation. So according to UNFPA, that works a lot with FGM, it's all procedures that just touches the woman's genital part. They cut the clitoris, they cut the lips, they cut the minora, the majora, and worldwide, it is believed that 200 million women and girls have been cut. And in Sierra Leone, for example, we think that over 80% of women have been caught. FGM basically is what we call the Bondo society in our cultures. And it's 89.6%, nearly 90% of women have been caught. And Maya Kaikai actually said after the Ebola, there was an increase in the numbers of FGM. And you ask, why is it increasing? We have more women going to school. We have organizations like 50-50 talking about empowerment. So why is this culture still going on? Because it's not been banned. It's not been criminalized. Women are still doing it. In the provinces, there's a stigma with not going to the Bondo Society. And now we are having forced initiations. We see it in the news, we read about it. And for whatever reason, the police actually fear the Sowis. So all of this is causing an increase. And these are just some of the complications. There is pain, there is bleeding, there is infections. And we can't not talk about FGM because of all the things about sexual and reproductive health. This is the one that actually infringes in your rights. It's somebody telling you that you should not have a particular part. Somebody telling you that you are not a woman because you have a part. Or because if you don't have a part, you are a woman, a man will marry you. Like you can't even think about it. And it leads to childbirth complications, excessive bleeding, difficult labor. And the study actually done in Sierra Leone in 2012 showed that 84% of women or girls who undergo the Bondo Society actually come in with complications. Because people keep saying, where are these complications? We don't hear about it. But they do come, and they do go for treatment. A majority go to traditional healers. Some of them come to the hospitals. So they do exist. So how do we end FGM? We have to put a ban on it. We have to have a government with a backbone to say it's not happening. We have to have a president with a spine of steel to say, no, it's their body, it's their right. We won't medicalize it because people are saying, what about if it is done in the hospitals? I did not go to medical school to cut a part that is not ill, that nothing is wrong with. So we are not going to medicalize it. We should be trying to stop it. And then in countries like Ethiopia, funded by UNFPA, they have the Uncut Girls Club, meaning because of this stigma that if you are not cut, you won't get married, girls don't talk about it. Girls want to join the Bondo Society. They want to be cut because they want to belong to women who they think have been cut. So instead, girls are coming up with these cool clubs to say it's okay not to be cut. There's nothing wrong with you not to be cut. And obviously, because as I said, when complications do occur, they go to the same Sowis, they go to traditional healers. We are saying if there is a complication, come to the hospitals. And you can go to the nearest Rainbow Center. So briefly, we're supposed to talk about infertility. And infertility is so common, meaning women who can't have a baby for whatever reason. And it's so common in our country. I'm sure somebody knows somebody who cannot have a child or who have been married or trying for a baby for years without conceiving. So basically, WHO defines it as a woman who's been trying to conceive for 12 months whilst having regular sex, but still yet not conceiving. And now they've included women over 35 years of age who've been trying to conceive for 6 months, but still yet have not been able to conceive. And because of that, you know, in our cultures, we believe that it's the woman who's at fault. But studies actually show it's 1/3 the woman, 1/3 the man, and 1/3 unknown causes. Because with men, we have to understand that they also can have fertility issues, like with their semen production, with alcohol intake, smoking. We know a lot of people drinking alcohol, and we know their wives are trying to conceive. It causes a decrease in their sperm count. And obviously, female causes. There's something called PCOS. It is really common, but we don't hear about it. We don't talk about it. It starts with you not seeing your period regularly, irregular periods. And we don't check for that. You don't go to the hospital for that. And obviously, salpingitis, as I said, due to PID. And there's something called Asherman syndrome. I just have to say it. Because abortion is not a contraceptive. When you keep having abortions and they keep doing, everyone knows what D and C mean. I'm going for cleaning. It's like they're scraping something. It leaves a scar. It leaves a scar in your womb, which makes your womb not able for it to be able to hold a child. So Asherman syndrome is very important, and we have to talk about it because of the way women and girls in Sierra Leone have illegal well, abortion is illegal anyway, so they have to go to quacks and everything to have these procedures. And how do we diagnose and treat? We diagnose with blood tests. We want to know if you're okay. We do an ultrasound scan to rule out fibroids. In Sierra Leone, we can do a bit. We can't do everything. We can do semen analysis to know what is wrong with the man's sperm. Sometimes the count is not enough. Some sperms have a head, it doesn't have a tail. What is the woman supposed to do with that? So we have to know all of these things, and that is how we treat. So we do this test, we give fertility drugs, and I put some of the community resources, some places where women can actually go. Because a lot of Sierra Leonean women go to, actually a third of women trying to conceive have been found out to actually go to traditional herbalists. And the herb that they give, which is sad, that particular herb causes abortion. We are not the only ones who have invented abortion. It has been happening since the dawn of time, and they use herbs. And that herb is actually given to women who are trying to conceive. So we tell women who are trying to conceive to come to the hospitals, because sometimes you're doing yourself more harm. And I understand the frustration, because in Sierra Leone we can't do we don't have assisted technologies. We can't do the fancy things that other countries can. But if you come to the hospitals, you go to 34 Military, the Mary Immaculate is Dr. Samba, Women's Health Center, Dr. Peters, Western Clinic, Dr. BC. They can at least do the little they can do, and then discuss to you about further options. Thank you very much. It's the end of